My name is Yogesh. I am a scientist at the Child Health Research Foundation. So I primarily work on I lead the molecular biology and biochemistry laboratory here. My primary interest is antimicrobial resistance. Like how does it spread? How does it emerge in different populations? And in Bangladesh, I'm specifically looking at the different kinds of antimicrobial resistant bacteria that are present in children in childhood infections. So we are right now here in like a sub-district called Mirzapur, which is about 60 kilometers north of Dhaka, the capital city of Bangladesh. And this is a semi-rural area where the Child Health Research Foundation has been working for many, many years. And so within Mirzapur, what we are interested in understanding is what are the kind of diseases that happen in rural populations in Bangladesh. What we do is we run a community surveillance where where a specific number of households are visited every week by community health workers to look at under 5 children and to really track in very granular detail what are the kind of diseases that are present in this community. Now, so what we really wanted to do today was to introduce various aspects of this surveillance to the CAMO-Net team. And so we started off first by looking at what is the process of how village health worker collects data from different rural households. So we visited 2 households and we saw like how the interview is conducted, how we use a tab-based system to enter all the information about the child into the program, and how using this process like the village health worker is able to provide advice to the mother about like symptoms to look for in child. And then after that we went to the Kumudini hospital itself, where we got the tour of the historic hospital by the director, who walked us through the various wards and the different kinds of programs that they run within the hospital. And we spend a lot of time in the pediatric ward, which is where obviously we work the most with, trying to see how they triage the patients, how they look for look for infections specifically, and what are the ways by doctors are trying to understand like how much antibiotic to use or where to not use antibiotics. So talking about antibiotic stewardship within that particular hospital. And so from there we saw basically the laboratory the Child Health Research Foundation has set up in the hospital, which provides patient service. So we looked at like the various departments, starting from microbiology, hematology, biochemistry, and all the services through that we are able to provide to the community. And so we think that this is a great model of doing surveillance as well as providing patient service at cost. So basically what Mirzapur, if you look at the rates of infections, rates of childhood mortality and neonatal mortality in Mirzapur and compare that to other districts in Bangladesh, then because of the efforts that we have put in versus the efforts that the community itself and the hospital has put in, Mirzapur has one of the lowest rates of infections within its population, right? And so first it's a lesson for other districts to take up and be able to roll out these kind of surveillance. But what we're really interested in is Mirzapur is going through a transition from being a rural district to transitioning into an semi-urban and a area which is very close to Dhaka, and it's having some of the urbanization or suburbanization effects of Dhaka. And so because of that, over the last 17 years, we've seen age structure change in the population. We're seeing more presence of non-communicable diseases, and the nature of diseases have changed. So the diseases that you would see traditionally, cholera, diarrhea, are much lesser now, whereas you're having pneumonia, respiratory diseases come up. Similarly, you have a scope to really set up genetic diagnosis and other things within the community. And so for us in the future, we are hoping that we're able to leverage this capacity to be able to provide the service that this community needs as it moves forward in its transition.
ফিরে পাওয়া শিশু